Updated COVID-19 boosters are now approved for children as young as 5.
The FDA and the CDC have given the green light for elementary school kids 5 to 11 to get the Pfizer vaccine and Moderna for those as young as 6.
It's to expand protection ahead of the expected winter wave, and UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us. Good to see you again.
Dr. Pothof, good to see you.
Hi, guys.
It's good news that these have been approved, but if you don't have the first 2 shots, you can't get the booster.
You're right. So in general, the youngest amongst us, our children, are vaccinated at a fair bit lower rate than the adult population. So if you have already vaccinated your child, gotten those 2 doses, then this booster is a good idea. But if you've got nothing yet, you still need to get that primary series, those 2 doses, and then 2 months later, you'd be eligible for this booster.
Adults too.
Same, yep.
So how important are these updated COVID boosters for kids?
You know, what I like about these boosters is they specifically target Omicron. And for kids in particular, we know that as a whole, they're less likely to get severely ill from COVID-19 than adults. But some kids do get really sick, and that's not a good place to be, especially if you're their parents. But we do know that kids do get long-haul COVID. And we know that vaccination, there's more study that's showing that if you're vaccinated and you get COVID, your likelihood of having long-haul symptoms is lower. So this means that kids who are vaccinated who then happen to get COVID, less likely to have that persistent fatigue, less likely to have the persistent brain fog, all these things that, you know, make being a kid a little bit harder. And that's another reason why parents are looking to get these vaccines.
And I was reading a couple of studies, I think from Pfizer, that these boosters are very effective.
Yeah, we don't have like the great data that says, you know, you're 90%, you know, likely to not have any symptoms. But when we look at the amount of antibody that's created against Omicron, which is still circulating, we got lucky that this vaccine matches what's out there. It's much higher, up to 8 times higher than that original vaccine. And that's got to translate to, you know, at the worst, equal performance, but probably a fair bit better performance compared to our old vaccines.
And does it give you an advantage because we've talked before about bivalent vaccines? It has some of the original vaccine and then the booster that is targeted for the Omicron subvariants in one shot, right?
Yeah, you're exactly
Do I have that right?
Yep, so we know that the original vaccine and the booster protects really well against severe disease, so we don't lose any of that. But we were seeing more people come down with symptoms as the virus had different variants. By specifically targeting the most common variant will likely decrease the chance that people who come across Omicron after being boosted would maybe even come down with symptoms.
And let's not forget the flu shot.
Yeah, it's easy to forget about the flu, but this year I think would be a good year to get the flu shot. We are starting to see a few cases here in the local area, not a lot, but if you haven't gotten that flu shot yet, the time is now. It's going to be a couple weeks and we'll probably start seeing some more cases.
Oh, I'm sorry, go ahead.
It's been a couple of years since we've been exposed to the flu, and our bodies are used to that.
I think, you know, we have some immunity from years past, but we've had a really mild flu season the last 2 years. I think that has a lot of folks with their guard down, kind of forgetting about what it's like to be at home for a week with the flu. This year, we're likely not going to have that luxury. I think we're going to see a fairly healthy flu season.
And there's been a lot of RSV going around, the respiratory virus that affects young children. Have you been seeing that at the hospital?
I actually have. I've been diagnosing it in the emergency department, especially the pediatric emergency department. RSV has been with us for a long time. It affects everyone, but particularly the very young. So under a year of age, they can get really sick from this. And then on the other side of it, older immunocompromised folks. But this is a respiratory virus that's really easy to spread, most often spread in our daycare centers, schools, things like that. Our older kids typically have mild symptoms. They go to school, they go to daycare, they get those younger kids pretty sick.
Something else to worry about. Thanks for being with us today.
Thanks,
See you next week.
Good to see you.